Intensive care doctors specialize in saving the lives of seriously injured or critically ill patients. In an intensive care unit, it's the medical director's job to coordinate these physician services and make sure patients are getting the best care possible. Here with us to discuss is Dr. Michael Patz, a critical care medicine specialist, anesthesiologist, and ICU medical director with San Juan Regional Medical Center. This is Celebrate Health, a podcast by San Juan Regional Medical Center. I'm your host, Prakash Chandran. So, Dr. Patz, thank you so much for joining us today. I truly appreciate your time. I'd love to get started by you sharing a little bit more about your medical background and how you specifically got into this area of medicine.
Of course. So I grew up around the Four Corners area in Grand Junction, Colorado. Went to the University of Colorado in Boulder for college. And then following that, I moved to Boston, where I went to Harvard Medical School, and then did my anesthesiology residency in Seattle, University of Washington. And then following that, I came back to Colorado for a critical care medicine fellowship. That was at the University of Colorado in Denver.
And Dr. Patz, did you always know that you wanted to go into critical care? I'm curious as to what drove you into that specific focus area.
It's a good question. Actually, I tried not to go into critical care, but I think it might be in my genes a little bit. My dad, he's a pulmonologist and also practiced critical care in Grand Junction. And my grandfather on my mom's side was an anesthesiologist and an intensivist also. So I knew it was a lot of work, and I, for that reason, initially tried not to go into medicine, and then certainly I was not looking to go into critical care just based on that alone. But once I got into learning about all the different fields in medical school, I think it was just so satisfying to take care of patients that so obviously were in need. We take care of some of the sickest patients in the hospital, and to be able to really rapidly turn some patients around and save their lives is extremely satisfying.
Yeah, absolutely. So I know that you are the ICU medical director. What exactly does that role entail?
Well, it's a good question. I think it encompasses a lot of things, but mainly I get to work with an incredible group that's really a multidisciplinary team. That's some other physicians, the ICU nurses, our pharmacists, our respiratory therapists, our dietitians, our physical therapists, our chaplain, our social worker. And we work together on a variety of things to improve the quality and the value of the care that we provide. And I think my goal as a leader of that team is to really help set some strategic priorities focusing on big picture goals, really to ensure that our ICU is providing the state-of-the-art care and also cater that care to our unique local environment that we serve. And so that's one component of it. I think the other component that is really, I think, the most exciting for me and for the hospital at this time is serving as sort of founder intensivist or leader for this new intensivist physician group that's going to be providing on-site physician staffing with critical care expertise every day of the year. So I think that's the most exciting thing for the hospital generally, because even while prior to this, the hospitalists and the nurses, the respiratory therapists were all delivering excellent care, the hospital still realized that with how many sick patients we serve in our ICU, there is a need for that extra level of expertise. And that's something that unfortunately hasn't become a standard, especially in rural ICUs, but it has been shown to dramatically improve patient outcomes. For example, in a lot of studies comparing hospitals where intensivists do staff the ICUs on site every day, there's 40% reduction in ICU mortality. So I think seeing the hospital take the initiative to bring us in and for me to be able to take that role is really exciting.
Yeah, absolutely. So there's a couple things that I want to highlight there. The first is that in the ICU, there really does seem like this big multidisciplinary team of people. You mentioned ICU nurses, pharmacists, chaplains. There's so many different people, and you basically orchestrate or coordinate them to provide the best care to the patient. And the second thing, and I imagine this is another boon to San Juan Regional Medical Center, is really being that founding leader for this intensivist group, right? Like someone that focuses on critical care for patients that can produce better outcomes because of that critical care knowledge and the multidisciplinary team. Is that correct?
Yeah, that's spot on. That's exactly right. And then we also provide an additional level of support for all non-ICU services. Just having us there for if a patient does become acutely ill, I think can be supportive to them. And then for other services, we can really serve as a backbone where Patients may more routinely go to the ICU, like after surgery for major neurosurgeries, trauma, or cardiothoracic surgery, or major vascular surgery. So it helps create the infrastructure for that.
Yeah. Given your experience in this critical care setting, I imagine that you have a lot of experience working not only with patients, but with families as well. What advice might you give to our listeners around just what they should know about the critical care setting?
Yeah, so I think the first thing to realize is that any ICU admission, it's extremely rare that any ICU admission is a planned thing. So they're almost exclusively unplanned. And as with any hospital admission, really, you don't know when you're going to get sick. You don't know when you're going to get in a car accident. And a large percentage of patients, once they reach the ICU, it's impossible to comprehend the situation you're in. And oftentimes you need someone else to make medical decisions for you. So it's our goal always to understand your wishes as a patient and to honor those and to care for you in the best way that we can. And for that reason, it's really important for anyone in the community, whether you're a healthy person in your 20s or 30s or in your 80s with multiple medical conditions. You want to think about when you come to the hospital, if you're sick and you're not able to make decisions for yourself, who do you want to decide who should make those decisions for you? And talk with that person or those people and start to think about the kind of care that you want and what your sort of goals would be if you're so sick that you need to be in the ICU. I don't want to go in too much detail about what to think of in terms of the goals of care, but perhaps that could be another cast for the hospital. In terms of what families should think about anytime close family or a loved friend is in the ICU or just in the hospital or very sick, it's a tremendous value, just your presence in the hospital, being with your loved one or your family member. It's actually been shown in clinical trials to have a very significant clinical effect in terms of outcomes. And it's also important to be able to communicate on the patient's behalf and really communicate what their values were and how they would want to be cared for. And one more thing to note there. So we have multidisciplinary rounds in the ICU every day at 9:30 in the morning. We always invite family and patients, if they're able to, be present for those multidisciplinary rounds where we get together with the various physicians, our pharmacists, and our nurses, our respiratory therapists, physical therapists. And we all come together and think about the patient together and think about what our goals are for the patient that day. So we always welcome family presence for those rounds.
Yeah, that is just so good to know because it's obviously a difficult time. And just having some answers and being able to talk to people that know what's going on, different perspectives, I think all of that really helps. So, Dr. Patz, thank you so much for your time today. I really appreciate it.
You're welcome. My pleasure. Thanks so much for having me on.
That was Dr. Michael Patz, a critical care medicine specialist, anesthesiologist, and ICU medical director with San Juan Regional Medical Center. Thanks for listening to this episode of Celebrate Health, a podcast by San Juan Regional Medical Center. For more information about San Juan Regional Medical Center, you can visit us online at sanjuanregional.com. If you found this podcast to be helpful, please share it on your social channels and be sure to check out the entire podcast library for topics of interest to you. My name is Prakash Chandran. Thanks again for listening. Be well.